We are the central lab for complement diagnostics in Germany, and we analyze samples from about 3,000 patients, which we receive from within the country and from internationally. We analyze these samples in order to support physicians diagnosing complement-mediated diseases. Our lab has over 40 years of experience in complement analysis and complement diagnostics. We have set up here a wide range of different assays so that we can really address many questions relating to the complement system. The tests we perform most frequently are the analysis of complement activation products like C3D. The parameter is C5b29. They check the complement activation at different levels of the complement system. One of our main tasks is also determine autoantibody levels in the patients. It's important to know whether for the physicians whether the patient has these antibodies or not, because it could influence the treatment and it contributes to the diagnosis of the diseases. In healthy patients, you wouldn't see complement activation, so it's a marker of inflammation. For testing the function of the complement system, we use hemolytic assays. This means that we test the function of the classical pathway by adding patient sera to antibody-coated, especially prepared sheep erythrocytes. And if the complement system is working well, then the complement system will kill the sheep erythrocytes or lyse them, and we can quantify the lysis by measuring the release of hemoglobin. We determine another complement activation product, C3D, with very ancient technology. It's called the double-decker immunoelectrophoresis, and their proteins are separated in a gel, an agarose gel, and in the lower part of the gel, the large fragment of C3 is held back, and only a small C3D complement activation fragment will migrate up in the gel, and we will detect this with color reaction in our lab. At latest, the results will be provided within 10 working days, except for some really rare parameters. But usually for parameters which are measured quite frequently, like a C5b29 and C3D, if it's really urgent, we can provide the results within 2 days. If the physicians have questions regarding the results or interpretation of the analyses, then they will give me a call and we will discuss the patient's case. And patients shouldn't be afraid of getting blood tests. First of all, it's important to analyze blood samples with regard to complement activation or maybe other markers to improve the treatment and to find the right diagnosis. So this is really necessary for optimal treatment of the disease. The samples are really only used for the analysis requested by the physicians. Nothing else will be done with these blood samples. After 4 weeks, the blood is destroyed.